Hello, this is Dr. Collins Harrell here to introduce you to a revolutionary new diagnostic tool called the Progressive Medit Ortho Simulation app. In 5 minutes, you can produce a set of realistic, clinically achievable tooth alignment simulations representing different treatment options appropriate to that case. This can easily be done chairside with a patient to discuss and plan orthodontic treatment or assist in planning implant or other prosthetic restorative treatment for a better orthodontic referral and better patient education. An STL file produced by any intraoral scanner can be used in the software. I'm going to give you a brief overview of how this tool works. First, we trim away any unnecessary data and fill any holes on the scan. Next, we place 4 points on the model to set the occlusal table for alignment. Here we evaluate the auto tooth identification to confirm that the teeth are defined, identified, and numbered correctly. If not, we manually click to find or define the tooth and edit the tooth number as needed. We can also define a tooth as being a primary tooth, unerupted or partially erupted, implant, or planned restoration, which will change the simulation outcome accordingly. Next, we evaluate an auto-traced lateral ceph and edit the location of key points, including A point, B point, tip of the incisors, condylion, and gnathion, and these will all end up having an effect on the simulation outcomes. Here we evaluate an auto-calibrated overlay. If not ideal, we detach the data and place points on the model and on the lateral ceph to correctly calibrate and orient the scan onto the lateral ceph. This then shows us the skeletal balance using green, yellow, and red colors to represent difficulty based on any disharmony in the skeletal vertical and antero-posterior dimension. Next, we select the starting size and shape of the arch form for both the upper and the lower arch, and make sure that the arch form is oriented symmetrically on the model, adjusting it as needed. The bite classification is auto-generated. Verify the marks are placed on the mesial buccal cusp tips of upper sixes and buccal grooves of lower sixes. Now the alignment simulations are automatically produced based upon all the data that's been input up to this point. Use the superimposition tool to visualize the movement of the anterior and posterior teeth that's required to produce this result. The superimpose tool shows the starting and ending position of the teeth to help us see the amount of movement that has occurred, as well as an animation tool that can be viewed from different angles. The ceph overlay tool helps us consider the skeletal resistance to the proposed tooth movements and the effect alignment will have on the lips and facial balance if the teeth are advanced or retracted. We click through different treatment options, such as expansion with IPR in this case. You can see using the same tools that this treatment option does not produce as much advancement of the anterior teeth as the alignment-only simulation gave us previously. Going back to the ceph overlay, we can see that this treatment option will have less skeletal resistance and less change to the facial balance since the incisors are not advancing as much. We could also click on an extraction treatment plan, for example, removing upper and lower fours in the simulation and closing the extraction spaces with moderate to maximum anchorage. Using the superimposition animation and ceph overlay tools, you can see that this is too much retraction of the anterior teeth for this patient. So option 1.4, non-extraction with expansion and IPR, looks like a good treatment choice for this patient. If we see any teeth with poor alignment, we can click on the tooth orientation tool at the bottom of the screen. This tool allows us to correct the way the software initially detected the starting rotation, inclination, or angulation of any tooth that was not aligned well in the simulations. All of the corrections made manually to the tooth orientation here will then be used to recalculate the simulations according to the edits made. This optional step would be more important if using the software to print your own aligners, for example. We then choose between the available bracket or aligner treatment option. If the brackets option is chosen, the indicated appliance is sent to SmileStream, including arch wires, bands, and brackets with correct torque prescriptions as needed. A step-by-step treatment plan can also be generated. If the aligner option is chosen, the selected simulation is then staged for aligners, with attachments being auto-selected for the movements required. The staging is designed to avoid collisions and move the teeth slowly for most predictable treatment if printing your own aligners off of this simulation. Alternatively, the STL files representing the final positions of the teeth can be produced and sent to Progressive aligners to guide the designers in setting up your aligner case. A step-by-step treatment plan is also generated for the aligner treatment. Thanks for joining me, and I know you're going to love using this game-changing technology.